Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health, and it's just so great to be back in the Sunflower House. And on today's podcast, we're going to talk about the brain. We're going to talk about the MIND, M-I-N-D diet, which is best for brain health. And we're going to talk about a supplement that helps brain health, N-acetylcysteine, NAC. And I'm going to talk about a very common mutation, the MTHFR gene. I won't really mention what some of my patients say as a shortcut for the MTHFR gene. But brain health is so important because we all have someone in our family or a loved one or a neighbor or someone who has suffered the devastating consequences of memory loss and dementia. In fact, 1 in every 2 women by age 85 will have dementia. There's a lot of controversy about how estrogen affects the brain. In general, it's positive. It helps with acetylcholine nerve transmission. Certainly loss of estrogen can worsen certain brain conditions. But on the flip side, if one has hardening of the arteries and has been without estrogen for a while and estrogen's put into the system, it can certainly increase clotting and plaque disruption. And anytime there's stroke or any atherosclerotic event to the brain, that can cause cognitive decline. We don't have any randomized controlled trials that show that estrogen reduces dementia, but we have a lot of observational data, and it does seem that if you start on hormones under age 65 and within 10 years of menopause, that there's actually brain benefit. Although that kind of reduces maybe the risk of Alzheimer's by 50%, which is closer to what a man's risk is. And as you'll recall, men don't lose their estrogen. They continue to make testosterone, which gets converted to estrogen. Now, there's lots of causes of dementia besides just the Alzheimer's type, and we're not going to go over all of that. We're just going to talk about just general brain healthy aging. And the first segment that I want to go over is the MIND, M-I-N-D diet. And we've got some great information on our speakingofwomenshealth.com website by registered dietitian Beth Bluestone. And she is a nutrition expert, and she talks and writes a lot about the MIND diet and eating right to keep mentally sharp. So we've done other podcasts about superfoods, and that was one of our actually most popular podcasts, and food as medicine, and how foods can sometimes interact with different medications. So the food that we choose can affect not only our bodies, but also our minds and our moods. Now, with dementia, Alzheimer's disease and mental decline being really a huge concern for our aging population, it's very important to choose the right foods that nourish our brains and keep us sharp. So a diet that's really rich in healthy foods that will nourish the brain and the body will help keep us sharper. And one of the most common complaints that I have midlife women present to, usually they're ones having hot flashes and night sweats and disturbed sleep, is brain fog. And certainly a lot of that does have to do with sleep disruption from hot flashes. But it also appears that it's an additional issue, also independent of that. And I tell women, and so many of them are afraid because they've taken care of an elderly relative, their mother, an aunt, a grandmother who's had Alzheimer's, that they're just petrified about it. And a lot of women's careers really start to take off after they're done raising their family, and maybe they're back in the workforce. Or maybe they're not in the workforce, but they're really looking forward to their next phase of life. So it's very important to always be mentally sharp. And some of the brain foods that are great are vegetables and berries and fish that's not heavy in heavy metals and mercury, and whole grains. So there was some published research from Rush University that showed that following a specific dietary pattern may be very important in preventing cognitive decline. So what is the MIND diet? Well, it's the Mediterranean diet and DASH intervention for neurodegenerative delay, MIND. And it's a combination of two well-studied dietary approaches. The Mediterranean diet, heart healthy, olive oil, lots of fruits and vegetables, colorful, and DASH, which is the dietary approach to stopping hypertension. And I'm going to have to do a podcast on hypertension because every day I talk to women in my practice over 50 whose blood pressures are elevated, and they say, my blood pressure is normal. It's always normal. It's always low. It's always low. Yeah. And pretty much all of us had really low blood pressure when we were younger. It does increase with age. And most people over age 50 to 55 do have primary hypertension. And rather than make excuses about hypertension, generally speaking, the lower the better, unless you're passing out or lightheaded. So for a long time, we've used dietary approaches to stop high blood pressure or reduce the risk in terms of reducing salt and sodium in processed foods, having more green leafy vegetables, more potassium, magnesium, calcium, all very good on the blood vessel wall. So researchers who've been following the MIND diet saw that people who followed this had over a 50% reduced risk of developing Alzheimer's than those who only moderately followed the diet and only had a 35% risk. So everything you put in your mouth is really important. So the three components of the MIND diet, I think, are pretty easy to follow because it's got three components, 15 dietary components, 10 food groups for brain health, and then the notation of the 5 unhealthy groups. So the top 10 foods that fuel your brain, that help with brain function and memory, they're foods that are rich in antioxidants like vitamin E. They have a healthy amount of omega-3 fatty acids, which have anti-inflammatory properties. And if you haven't heard the podcast on omega-3s, go back and listen to that, because the bottom line is getting omega-3s from your food is so much more superior than just swallowing it in a fish oil capsule. These foods also have plenty of B vitamins, folate, vitamin C, and vitamin D. And later in this podcast, we're going to talk about folic acid or folate and L-methylfolate, the active folate that helps support methionine and a lot of the neurochemicals in the brain. So let's go over the 10 foods that help fuel your brain. Green leafy vegetables, a salad a day. Leafy vegetables such as spinach, kale, collards, romaine. Oh, all my favorites. 2, other vegetables, at least 1 serving a day. And sometimes people will get combined dehydrated foods, fruits and vegetables that are combined and then just mixed in a drink, because some people do have trouble getting their fruits and vegetables in. Number 3, nuts. 1 little serving, which is just a quarter of a cup or a little bit in your hand. And walnuts and almonds are very good for omega-3s. Number 4, berries. And this summer is the season for blueberries and strawberries. Try to aim for 2 servings per week. And blackberries and raspberries are also rich in CoQ10. Number 5, beans. Every other day, or try to get at least 3 to 4 servings a week. And we're talking about lima beans and green beans and brown beans and black beans and pinto beans and black-eyed peas. So they're generally inexpensive foods. They're very high in fiber, and they have protein, and they're good for your gut microbiome, because the gut microbiome does seem to affect cognitive function as well as pretty much every other process in the body. Number 6, whole grains. Number 7, fish. 1 to 2 times per week. Now, young children and pregnant women have to be a little bit more careful and make sure that they're not ingesting the large fish, the contaminated fish, tilefish, swordfish. You can, Google like a list of foods of fish that are more likely to be contaminated with heavy metals. We generally like fresh salmon, not farm-raised salmon. Number 8, poultry, about 2 servings a week. Number 9, olive oil. That is your prime heart healthy oil. And 10 is only if you already drink wine. And I have had women in my practice who don't even like wine, but they force themselves to drink it, which is ridiculous. It's calories, it's alcohol, and too much alcohol can be bad on your brain and liver. But if you do have some social alcohol, then generally speaking, the red wines with the resveratrol. But if you don't like wine, just have some grapes, have some more fruits and vegetables. So what are the 5 unhealthy foods for the brain? Well, harmful foods usually have trans fats or really excessive amounts of saturated fat. And having foods that oxidize the brain can increase Alzheimer's and dementia. And so things that you really don't want to go hog wild on or eat at all would be fried foods and fast foods. If you're going to do fried foods, do it at home, use heart-healthy oils, and just no more than 1 serving a week. We're not saying never. The next one is pastries and sweets. I mean, sugar really is not very good for anyone who's past childhood because it really drives up triglycerides. It really causes inflammation. It really packs on the weight. And so limit that. Next, margarine. We wouldn't really use margarine. Probably butter is better, or olive oil, or just the normal nuts and seeds and, fresh avocado. That's a better way to get your fat. And obsessively reducing fat is not good. It's important to have heart-healthy fats. Now, red meat has lots of nutrients, from protein to zinc to iron. However, in some people can really drive up cholesterol, and in general, you should not usually consume it more than once a week. And then cheese, some very high-fat cheeses and processed cheeses you would want to reduce or eliminate. Now, there are some heart-healthy, lower-fat cheeses, and certain cheeses like Swiss Gouda and Blue have K2, which is also known as M7, which helps get the calcium into your bones and not your heart. I did a podcast on cheese and how it's rich in calcium, but you have to be very cognizant of the serving sizes. And the really high-fat, luscious cheeses like Brie and Camembert, you really want to limit that mainly just to holidays. So if you really focus on the fruits and the vegetables and the nuts and seeds and berries and beans, and then heart-healthy fats, and then appropriate lean meats being fish and chicken and lean red meat, that is kind of a very kind of good approach. The old pyramid that's full of grains and breads and pastas, really for many people is not the way to go. So how do you put the MIND diet in action? Well,
we'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
For many people, the Mind diet could be easy to follow because it focuses on whole foods and eating more vegetables and fruits and cutting back on all those processed foods and sugar. And certainly there's no reason to get any trans fats in your diet. So what are some tips? Well, saute vegetables in olive oil. Top your salad with beans, like add some garbanzo beans or black beans or kidney beans. If you think about that, a lot of casseroles you can add beans to, and it doesn't have to just be baked beans, but baked beans are fun in the summer. I use all different kinds of beans, butter beans, lima beans, green beans. Consider using lean ground turkey or chicken in place of ground beef. And instead of having a pastry or some fast food, pack little tiny stacks of like unsalted walnuts, almonds, or pistachios if no allergy. And then choose fruit and berries for desserts instead of cookies and pastries. And experiment with new vegetables and fruits and try different dishes. Check out our recipes on speakingofwomenshealth.com. So let's kind of go over like a sample menu. Certainly if you're intermittently fasting, like I recommend most people to do, you may only have 2 meals and a snack. And if you're not pregnant, you're fully grown, you're not a growing child, and you're able to intermittently fast, I think that has some anti-aging effects. But let's just do a traditional 3-meal with a snack menu. So you could start off your breakfast with scrambled eggs. And you can get the scrambled eggs that are rich in omega-3s, particularly if you don't like fish. And they feed the chickens omega-3. You could add spinach and bell peppers, mushrooms, and maybe have it on a slice of whole wheat toast topped with a slice of avocado. A nice lunch might be salad with chickpeas and blueberries and slivered almonds, and maybe some grilled or roasted vegetables with just a little spritz of balsamic vinaigrette. A nice dinner would be grilled salmon with asparagus and some quinoa on the side, with some other interesting herbs and spices. If you didn't catch our herb and spice podcast, that's a fun one to listen to. And then for a snack, you might want to take some fresh vegetables or whole grain crackers with just a little bit of hummus. Hummus is chickpeas. And if you color your plate with different vegetables and you brighten up your meals with berries and have some wild salmon, these are all just great for you, for your heart, for your brain, for your joints, for your skin. And our functional medicine doctors really do a whole lot with respect to diet and health concerns that people have. And what you eat does affect how you feel. There are definitely foods that make you mentally sharper. And all of us, after age 20 on, and certainly midlife and beyond, should be concerned with healthy aging and maintaining cognitive function. So one of the supplements that I sometimes do recommend, it can be prescribed, but it's currently over the counter, although it's kind of sometimes been, sometimes has not been. And again, remember, this podcast is just to empower you to be strong, be healthy, and be in charge. It's not medical advice. But N-acetylcysteine is an important supplement for you to know about. It's a semi-essential amino acid, cysteine, and an essential amino acid has to be ingested because the body can't make it on its own. But a semi-essential amino acid can be made in the human body. So, for example, our bodies can make enough cysteine if we have enough serine and methionine in the body. And serine is an amino acid, which is one of the protein building blocks, and it can be supplied from food that you eat, or it can be synthesized in your body. And methionine is an amino acid found in proteins, in foods, and also proteins found in the tissues and organs of our body. Now, L-methylfolate is the active form of folate or folic acid, and it supports methionine being converted into serotonin, a very important neurotransmitter. And you might have remembered me talking about serotonin and other brain neurotransmitters in one of our favorite podcasts on chocolate and why women crave chocolate. And it's very important to have the right balance of amino acids because they're not just the building blocks of protein, but also the building blocks for neurotransmitters in the body, which affects brain health and gut health and vascular health. So most people who get a healthy diet can usually make enough of their own semi-essential amino acids, or they can directly just ingest cysteine. So what are some of the foods that are rich in cysteine? Well, they tend to be high protein foods like turkey, which also has tryptophan, which is why people sometimes feel a little sleepy afterwards. Chicken, eggs, legumes, cheese, yogurt, and sunflower seeds. So cysteine is critical for replenishing one of the most powerful antioxidants in your body, which is glutathione, and one of the most important neurotransmitters in the body, glutamate. So what is glutathione? Well, we need antioxidants in our body because they're kind of like the scavengers. They take care of free radicals in cells. And glutathione is really one of our body's most important antioxidants. It's great for the kidneys and the liver, which are the two organs that are our body's powerhouses for cleaning up toxins and metabolizing medications, hormones, and various substances. In fact, we give glutathione intravenously in people who've had acetaminophen Tylenol overdose. It really doesn't take too much acetaminophen to kill your liver. And if you add alcohol with your acetaminophen Tylenol, it's not a good combination. It can actually be deadly. Now, many medications that we use to treat medical conditions themselves like diabetes type 2, can be hard on the kidneys and liver as well as the disease itself. And glutamate is a very important neurotransmitter in the brain that is supported by NAC and acetylcysteine. So if you're low in glutathione and glutamate, you can see more neuropsychiatric disorders, including depression, obsessive compulsive disorder, and Parkinson's. So in any of my patients who've had any hormonal mood disorders, postpartum depression, any PMDD, women with Parkinson's, OCD, any neurologic condition, I always want to make sure they're on a healthy diet, that they have adequate glutamate, that they're not on any toxins that are bad on the brain, kidney, and liver, that they're hormonally in balance, and that they also have adequate B complex and L-methylfolate because those are really needed as substrates. Now, for adults over the age of 50 who notice specific word-finding difficulty, it can indicate a lot of different things. Lack of sleep, inattention, menopause, low estrogen state can definitely reduce acetylcholine in the brain and lead to what people call as brain fog. Now, low B12 levels from a dietary issue of GI malabsorption can occur in people with so-called pernicious anemia, and they require B12 shots. People who've had part of their stomach removed or their distal ileum cannot absorb the B12 and will need B12 shots. Obstructive sleep apnea is very common. In fact, I interviewed Dr. Margaret Frankel, the dentist, who talked a lot about oral dental treatments to treat obstructive sleep apnea. But if you're choking off at night, your oxygen levels are low, and that's really bad on your brain and your cardiovascular system. People that have undiagnosed hypertension, diabetes, depression, all of this can overlap with brain fog. And some of the common nutritional deficiencies include vitamin D deficiency in northern climates and just even in adults over age 40. And zinc, that can also affect brain function. Sleep disorders are very common and treatable, and we've had several podcasts on sleep disorders. So if conditions are evaluated in treatment, but treated, these underlying conditions and vitamin deficiencies, and you still have brain fog, then you might want to talk to your physician about trying a methylated vitamin combination that has N-acetylcysteine. And there is one prescription vitamin called Cerefolin NAC. There's also L-folate plus, which is methylated vitamins, which is over the counter, and you can get that online without a prescription. During COVID, sometimes you could not get N-acetylcysteine, which is good on the lungs and the liver and brain, but I've just subsequently seen it online as a vitamin. In high doses, it is used as a medicine in overdoses, but I think that to boost that by 600 to 1,000 milligrams per day is not a bad idea. We, of course, want the MIND diet along with exercise. And sometimes boosting glutamate can really help improve very minor cognitive problems. Now, lung conditions such as COPD, chronic obstructive pulmonary disease, asthma, cystic fibrosis.
We'll be back after a quick break.
Have you ever experienced fitness failure? You know, you set a goal to exercise, you're all excited, and then you're not. Hi, I'm Dave. I host the daily 10-minute podcast, Walking is Fitness. Instead of an exercise goal, I talk about making a fitness promise. And every day you keep that promise, you add another link to a growing fitness chain. This is a podcast of action. You'll create a fitness habit, which eventually becomes fitness momentum, and then on to all kinds of good stuff. Check it out. Walking is Fitness, and let's take a daily 10-minute walk together.
Lung inflammation. Sometimes those things can be improved by replenishing glutathione via NAC supplementation. Of course, all this should be done under a physician's supervision. Other conditions, there's research going on to see if there's a role for NAC with cardiovascular disease, infertility, and autoimmune conditions. And there's really no RDA or recommended daily allowance because cysteine is a semi-essential amino acid, and your body has the ability to make cysteine on its own when you have enough folate. Pyridoxine is B6 and B12 methylcobalamin. Now, B12 is that really huge, big vitamin. It's got a long half-life. If you have adequate stores, they can last for years. But I usually start to check B12 levels in adults over 65, sometimes sooner, if they're on medicines like PPIs, proton pump inhibitors, or glucophage, metformin. There's certain medications that can lower B12. People that are strict lacto-ovo-vegetarians, and if they get no milk or eggs, can be low in B12. Anyone with peripheral neuropathies, I'll usually get B complex levels. So a healthy diet and exercise, control of any chronic medical conditions really are first-line defense, but sometimes we consider selected vitamins and supplements such as NAC. So moving on to folic acid, folate, and one of the most common genetic variants, MTHFR, which does have the potential to affect emotional and physical health. Now, what does MTHFR stand for? Well, it stands for Methyl TetraHydroFolate Reductase. And this is a gene that produces essential enzymes in your body. And MTHFR plays a key role with regard to many aspects of physical and mental health. So we each get an MTHFR gene allele from our mom and one from our dad at conception. And there are some common changes or mutations in this normal gene. And a mutation is just a naturally occurring process that causes a specific variation on one or more alleles of a particular gene, just slightly changing a sequence in our DNA. So if you have a mutation on both alleles of a specific location on the gene sequence, that's called homozygous. And that's usually associated with a greater impact than if you just only have one allele from one parent, referred to as heterozygous. And these mutations are so common they're just generally referred to as normal variants. So many geneticists and physicians don't even think people should be tested for this unless there's a specific reason. And since it's so common and half the population has one mutation and 10% can have both mutations, many in the field do not recommend being tested. So I'm just a little bit more specific in thinking about this in terms of people with refractory depression, bipolar disorder, which is really very hard on the person themselves and also their loved ones. Migraine headaches. Most migraineurs usually have at least one mutation. Schizophrenia, attention deficit disorder, ADD or ADHD, autism, recurrent miscarriages, recurrent DVTs or blood clots, and some cases of heart disease. So it's worth understanding about this really common mutation if you have some of these medical conditions in your family or yourself. Now, as I mentioned, because up to 50% of the population may have a variant of MTHFR, many say it's just not worth being tested. And it can be very expensive. The blood tests can be hundreds and hundreds of dollars. A lot of insurances won't cover it. And gene site analysis, which sometimes psychiatrists do, which involves swabbing the cheek, and it checks for lots of genetic things, including MTHFR, as well as how you metabolize drugs through the liver. That includes psychiatric medications, pain medications, some heart medicines, and anticoagulants. So if you have that test done, which can be very expensive, those results don't change. That's just kind of what you're born with in terms of the metabolism. So if you've had that gene site testing done, then you can look at your MTHFR status. Now, I'm most concerned about homozygous MTHFR of the C677T. And that's a lot more concerning than the A1298C or the so-called compound heterozygote, where you get the C1 and the A variant, one from each patient. So most of them are not considered to be of any serious clinical significance. And your doctor can discuss the differences with you and how that may affect your personal health. If you have one of the three listed variants, though, you may or may not want to take optimized folate. But since L-methyl folate, as long as your B12 level is normal, a lot of times rather than spending the money to test for the mutation, if a person has concentration issues, ADD, depression, just don't really feel like themselves, maybe they have migraine headaches, I'll say as long as the B12 is normal, you can just get optimized folate, which is L-methyl folate, over the counter. You can order it online. Certainly in very high doses like 15 milligrams, as opposed to just say 0.4 milligram or 1 milligram, which would be closer to the just a regular daily allowance. In very, very high doses, it's sometimes used as a vitamin to potentiate certain antidepressants. If you do have the homozygous C677T variant, I would definitely, in that group of people, recommend taking the L-methyl folate, as well as perhaps methylated B12 as well, like is available in the L-folate plus over the counter or the Serafolin NAC. Now, what is MTHFR's connection to autism and ADD? So preliminary research suggests that adequate prenatal intake of folate in those first 3 months before conceiving and during the first month or two of pregnancy in particular can potentially reduce the risk in children. And I think that's very important as we've had such an increase in autism. Some of the newer hormonal contraceptive pills are actually including L-methyl folate, also called levometholate. And it's also colloquially known as optimized folate. So if you're homozygous for the MTHFR mutation, then you can eat folate in cereals and orange juice or oranges and fruits and vegetables, but your body won't convert it from folate to L-methylfolate. And you need the L-methylfolate to support methionine, which then supports neurotransmitters. So, Yaz, BS, Safrole, Yasmin, those are synthetic estrogen with drospirenone combined for a pill that also adds the L-methylfolate. And those are actually FDA approved to treat severe PMDD and PMS. If you're on a generic without the vitamin, you can just get the vitamin L-methylfolate, over the counter or off the shelf and put it, together. The reason why this was added was because the March of Dimes encouraged these contraceptive agents to have the long-acting optimized folate to reduce neural tube defects like spina bifida and anencephaly. So since almost half of pregnancies are unplanned, and since regular folate has such a short half-life of 6 hours, the optimized folate, L-methylfolate, can last months. So if you have a couple bad days of not eating well because you're sick, nauseated, pregnant, whatever, you're still going to have good L-methylfolate levels for that developing baby. So I think really all reproductive aged women should have ideally 0.4 to 1 milligrams of L-methylfolate. And in higher doses, as I mentioned many times, psychiatrists will use it to treat mood disorders. So when should you see a doctor? Well, if you haven't responded to conventional medical treatment for some of these common disorders, like depression, migraine headaches, mood disorders, PMS, PMDD, anxiety, panic, and also peripheral neuropathy, then it may be worthwhile talking about whether you should be tested for this mutation or just simply check your B12 level and add the L-methylfolate. That's probably the least expensive way of doing it. Now, if you've had multiple blood clots or multiple miscarriages, or you have very high homocysteine levels, then you should definitely be checked for MTHFR. So if MTHFR mutation is part of your genetic makeup, just like your eye color, your height, it's not cured, but it's so easily treated, because if you've got that homozygous variant or that compound heterozygous state, or even just a single heterozygous single allele, you can take L-methylfolate in as long as there's adequate B12. And despite some increased risk of some conditions, having a specific MTHFR mutation actually has been associated with a lower risk of ALL, acute lymphatic leukemia, and some forms of colon cancer in those who still maintain adequate levels of folate. So it's complex. And if you have an MTHFR mutation, you need to know that you just don't metabolize folic acid, the synthetic form of folate that's found in lots of processed foods like cereals, breads, and vitamin supplements. So 7 steps to reduce the risk associated with the mutation. Like I said, they're simple and inexpensive steps that you can take that might help you respond better to certain antidepressant, anti-migraine therapies, and maybe help you feel better. You'd have to check with your insurance company to see whether they would cover MTHFR testing. As I mentioned, many insurances will not. If you're on a folate supplement, you can just swap out simple folic acid for the more bioavailable optimized L-methylfolate. This is much more usable by your body, and it's easily found in health food stores, many pharmacies, and online. Sometimes you'll see L-methylfolate referred to as levomefolate or optimized folate. Now, it can be prescribed by a physician or APP in the form of a high-dose capsule, 7.5 milligrams or 15 milligrams of Deplin. But you have to definitely make sure that there's a normal B12 level first. And this seems to make some antidepressants work more effectively. Now, I've had some people who take a lot of L-methylfolate and they notice that, and it's very interesting, they've told me that they notice that it's harder to climax, because if you boost things that boost serotonin, whether that's selective serotonin reuptake inhibitors like antidepressants, and you're satiated with serotonin, it would be harder to climax. So just because something's good, just like it's good to drink water and prevent dehydration, you don't want to be ingesting gallons and gallons of water a day, obviously. And it's the same thing even with water-soluble vitamins. Now, eating green vegetables, that is so important to strive to eat folate-rich foods, because they have antioxidants and many other phytochemicals that are very good for you and reduce cancer and heart disease. Broccoli, lentils. B12, MTHFR can impact the processing of methylation, which also comprises the absorption of B12. So if you do have MTHFR mutation, it's probably better to ingest methylcobalamin rather than the more commonly cyanocobalamin to help with B12 absorption. And B12 is critical for good mental health, memory, and peripheral nerves. And as I mentioned, in some select people over 50, I may prescribe Cerefolin NAC, which has 600 milligrams of NAC, which you can buy separately. It has methylated B12 and 2 milligrams of L-methylfolate. And you can get all of those things separately, generally for less money than the prescription. If you're a patient who has type 2 diabetes and has peripheral nerve damage or diabetic neuropathy, there is another prescription vitamin called Methenix, which includes methylated B12, L-methylfolate, and also B6 pyridoxine. In terms of pregnancy and MTHFR, if you are planning a pregnancy and you're homozygous for MTHFR, you probably will need to add not just L-methylfolate, but also talk to your physician about other options, particularly if you've had DVT or lupus or other miscarriages, because sometimes blood thinners or aspirin or other things may be done with your obstetrician or midwife to optimize your pregnancy outcome. Children in MTHFR, if your child or your grandchild's parent has an MTHFR mutation, particularly if the child's got some ADD or mental health issues, you might want to speak to your child's pediatrician or family medicine clinician about whether L-methylfolate should be used. So again, this is all information to kind of arm you to be strong and be healthy and be in charge, because brain health is really key to functioning optimally in society. And I hope that you've enjoyed joining me in the Sunflower House for this podcast on the MIND diet and N-acetylcysteine and optimized folate and MTHFR. And for more information on these topics, please go to our website, speakingofwomenshealth.com. You can subscribe for our free newsletter and health tip. If you're so inclined, you can donate to our nonprofit. You can catch us on Rumble on Speaking of Women's Health, and you can listen to a podcast anywhere you catch your podcast: Apple iTunes, Google, Amazon Music, Podbean. So thanks so much for joining me today. I'm your host, Dr. Holly Thacker. Please join me next time for the next edition of our podcast.